my dear friends. So I'm here with Dr. Adamya Gupta. So he's a DocTutorials subscriber who got an excellent rank in clinical hematology. So first of all, a big congratulations for your amazing rank. So Adamya, it's your day. So tell us about your background, your brief introduction. Then we'll go into your journey into hematology.
Good evening, sir. It's a pleasure talking to you. I'm Dr. Adamya Gupta. I've done my undergraduation from Government Medical College, Nagpur, in the year 2010. And then in the year 2017, I've done my post graduation in MD Medicine from MJ Medical College, Indore. And after that, when I passed out, during my MD days, I had a slight inclination towards hematology because we used to see benign hemat cases there in our medicine postings. So that is how I developed a bit self-love towards hemat and the topics regarding that.
So Adamya, let me ask you, like compared to other subjects, neurology, cardiology, and gastro, the hemat it's a newer baby. So how do you like really decide when the point when you decided that yes, I should go for clinical hematology? You know that seats are less, but how did you land up in hematology? How did that passion occur?
So it was during our medicine posting when we used to get some cases of aplastic anemia and ITP. Then what we came to realize during our postings in our learning in post graduation days that even though we think that these cases are not treatable, but that is not the present case scenario in these days. Although the drugs may be a bit costly, but there are some organizations which support the patients for the funds, and for if in case if there is any treatable cause and the treatable medicine is available, they'll support the patient. So that's how I came to know that we can even give Altombo pack for aplastic anemia. So although the drug has to be given for longer duration, but usually, sir, in medicine, what we think oncology is something, especially hemato-oncology is something which is usually as soon as you diagnose, you have to ask the patient to book your tickets to some place like for some so like तीर्थ यात्रा के लिए we send them. Okay, now these are his last days and he has to nothing's gonna work. But during those days, I realized it's not the case these days. These days, we have a treatment for most of the, I should say, most chronic malignancies. We have treatment. So that's how I developed a bit of interest towards hemat. And our teacher, especially Dr. Manoj Gupta, sir, he's practicing hematology in our department in medicine. So from him, I learned that hematology is an extension of medicine, not actually medicine.
Exactly.
Very less of clinical judgment, more of a investigational approach.
Exactly.
So that there's always this thrill of diagnosing and then trying to save the patient there itself.
Exactly.
While in
Because the whole scenario is different because the hemat is the most enthusiastic because I am being a clinical hematologist, I am being a faculty at DocTutorials, but in my times also this hematology was a growing baby kind of subject, but the whole scenario is different when I look back. So it's a more into research, more you can move into research, more into the clinical scenario, transplants. It's a very exciting arena, and more young and brilliant people like you should come forward, right? So, regarding your preparation into your hematology, now you got a seat in AIIMS 2022. So, before that, there is a journey for every DM aspirants, right? Starting once you finish your MD until you reach the DM, there is a journey for everybody. And what's your story on your journey?
So my story is a very long story, sir. A lot of failures in my story. I started my journey, sir, in probably in March 2021, and I started reading some textbooks and hematology books like Hofbrand and a bit of Harrison. But I found that Hofbrand is too much to read, so I moved to Bethesda. Bethesda is a very small handbook kind of literature, so it's very for fast reading and to get a overview of the subject. It's good book, and along with that, I started reading Harrison, and then I gave AIIMS. In at that time, it was not Institute of National Importance kind of super specialty examination. It was a different set of questions for AIIMS and different set of questions for PGI Chandigarh. and I got some marks around 37 marks there in AIIMS, but could not qualify the exam. Similarly, sir, was the case with PJ Chandigarh also. I could get hardly 39 point something marks. So this NEET SS exam, then that the exam got delayed and delayed. Then one of my friend actually, he told me that why not join DocTutorials. So I joined the DocTutorials, and the quality of questions you get in DocTutorials, clinical based questions and the image based questions, is exactly what they ask in INISS. I still remember one question which was asked from DocTutorials, and it was as it is. It was asked in the INISS exam November this in the July session 2020. So then I started to have more faith and more focus towards the question bank of the DocTutorials, and soon I had to figure out my when I started giving test, my rank was around somewhere around 35, 30, 40. And persistently, when I gave test, the month of November came. But unfortunately, sir, there also I could not get any score or any rank. And I was very ambitiously looking towards NEET SS in the month of Jan. And when I gave the exam, my rank in the test was still around 25, 35, like this. When I gave the exam, I was very confident that I could get a rank. But sir, I over attempted the questions. I had a chat with one of my few seniors who were also giving the exam, and they told me how many questions did you attempt, and I said 99 questions out of 100.
Oh,
So
okay.
that gave a very big blow to my rank, sir. And I don't know, somehow it shifted to around 74 rank. But what I was wishing for, the college I was wishing for, I could not get that. And then I was very curiously waiting for this. Maybe the counseling may do some miracle to me, like every student has. So even the first round of the counseling, it didn't go well. I was not allotted anything. But I continued my preparation. I thought maybe this exam, maybe in the next exam I'll clear. So in 23rd of May, I gave INISS exam, and while giving the exam, there were like two kind of things they were in my brain during the time I was giving exam. First of all, I thought all the mistakes I have committed till now, I have to commit none of them. And one of them, important one of them, was not to like overdo the questions. But sometimes they just want you to attempt the question. For a question, they asked, okay, which of the following is a FLT3 inhibitor, and out of four, three were FLT3 inhibitor, and they were asking which of the following is the FLT3 inhibitor. So I left that question. I know they want to make a negative mark out of me, so I left that question. So all these experience which I collected through my failures, I utilized in this exam, and finally, sir, I'm happy that I might be getting.
Yeah, this time that too in a central institute, right? So this DocTutorials question banks. So I got your message when the time I joined. You messaged me like NEET SS. You got 74th rank. You didn't even get a seat. So now I'm preparing for INISS. So we had a brief chat on that also. Like, okay, this time we'll be doing this. We'll be cracking this, right? So the how do your confidence level regarding your confidence level. So this question banks, how helpful was it for you? Like Elite SS also, I made a question bank for 60. So I saw the scoreboard. You are the second. You got scored around 220 marks or so. So that time also, okay, this guy, those are students, we can judge the students. Okay, this guy is going to crack this time anyway. So so how was the confidence boosted from the DocTutorials that you got?
I feel like in branches like Hemat and some other rare branches, which usually medicine people don't go for, I think there's a lot of myths, lot of books, lot of opinions, and lot of study material is available, and which is of no use. I'm telling you, sir, because I had a very long journey, and I had almost tried everything to get into some college and a DM seat. When I joined, but sir, when you have a teacher who has a personal guidance and personal motivation for you, like sir, at the right time, you joined the DocTutorials at the very right time, because I was needing a guidance, and I was needing a personal coaching, so that I can like those points where I was lacking, I could correct those things. So it's even though, sir, I may not be knowing too much of the data, but just because you know that you have someone to discuss your problems and someone to discuss your doubts, then it inherently, it from the within of yourself, you are sure that yeah, now you are progressing. That builds up the confidence to the next level, and you are more sure that your patchwork has been mostly done. Nobody can complete 100% of the patchwork, but those lacunas need to be filled. Otherwise, the osteoclast will eat up the whole bone and nothing will be left. So those lacunas, your knowledge, yes, sir.
Yeah, now you're taking the hematoids. You're in
Yes,
the
sir.
bone marrow already. Yeah. So how was your preparation difference for the NEET versus this INSS? For the other students, how different is the preparations you had for both? Because it's a more subject specific for INSS, right? And Harrison, as well as you have to balance both, right? You have to have a thorough knowledge over the specialty.
So in NEET SS, they don't go very deep in the hemat subject or specialty subject, and even the medicine part, it's not very hard, but maybe I did many things wrong. It didn't go well with me. But if you are very well versed with your post graduation subject and your medicine during your post graduation days, you have read Harrison on a regular basis. I don't think tracking to the NEET is a difficult task. But since there is a more focused approach required in INISS, they don't want to ask you more about general medicine, even though they ask general medicine. But those questions are mostly based on your chronic knowledge. They doesn't depend on your recent knowledge of medicine. And regarding hematology, sir, they mostly ask questions which are mostly guideline based. Directly from the guidelines, they pick up the statements and they ask. Like one of the questions they asked this time was, maybe I may be a bit off here and there, but mostly they wanted to ask that which of the following is not a MRD marker in AML, and there were many options. The answer was FLT3. So these kind of, and this is a single line mentioned in a guideline, usually in American guidelines. So most of the guideline based questions they want. So they want to check either you're working in the hemat department or not. Or if you're not working, then maybe going through DocTutorials subject matter might help you, because in for every question there is a very good explanation, detailed explanation. Even if you make notes out of it, you're gonna going very strong for that.
Yeah.
Going strong for that.
That's what allied questions also. Most of them were guidelines based, because if you read the guidelines, especially NCCN and other guidelines, ASCO guidelines, so you will be very thorough through the topic. And the WHO guidelines, this 2016 definitions, all those things should be that has to be very thorough, so that you can answer up to almost many questions, 90% of them. So, and coming to the interview, your theory part you said. So, coming to the interview, we had I think 2.5 hours on the day before the day or the one day before your exam. So, how it was useful to you for the interview?
So I had this people get stage fright. So I'm one of those who get frightened by these bivas, but our career, our medical line is something like that. We can not ever get away with all these things. They like again and again they haunt you back. So the most of the questions. So when I had a session with you, I thought maybe I had to study more. But the way you revised most of the malignant hemat and you highlighted the important topics of they might be asking in interview. So sir, most of the questions were from the our discussion only, and I was very fluent while answering the questions, like because we had discussed the day before only. So I think they might be having a good impression of me.
So that's why you got the AIIMS rank 5 and common merit rank 6. Okay, so on this rank you might have talked to other candidates if you know them, or so how is your future plan? So what would be your future next step? So already you are in that kind of a mindset. Yes, you have cracked it. So now that you are more confident, and you must be having a future, what all the other students might be interested to know. So please.
I want to learn more of whatever hematology I might be learning in the central institutes. Probably if I'll get PJ Chandigarh, or if not, then AIIMS Rishikesh would be the only choice. Because there are very less seats in clinical med, hardly 8 seats are there. So I'll be going with that, sir. Rest, maybe in future, if required, or if time permits, I'll be learning more about malignant hemat through other institutes. Or
what is your advice to your fellow colleagues? So you might have friends or your juniors who might land up in hematology. So people think that's a rare specialty. So, but what do you think about advice should you give, like your fellow colleagues who might
first
be
thing,
a hematology aspirant?
the first thing I would say, one should try hemat. It's not as boring as people think. It's very interesting subject. Otherwise, people think onco is like more genes, cancer, and drugs, chemotherapy, drugs. So people get a bit medicine, especially medicine folks. They get afraid. It's not like that. It's very very conceptual and logical subject. You can derive one thing from the other. Second thing, if one is preparing for INISS or exams like NEET SS, one should have good patience, because seats are very less. Now one is not able to crack the exam, but in future, because they say that the success can be delayed, but it's not a failure unless you stop trying. That was the mantra behind all this. So if I am able to do, I think most people will be able to do, because I belong to a very average background, very average medical colleges during my undergraduation, post graduation. And keep faith in yourself. Start whatever notes you make, whatever topics you read, consolidate them on everyday basis, solve MCQs regularly, because solving MCQs makes you learn the topic in a better way, and that's it, sir.
Yeah, the
Just
rightly said, Adamya. So this is not failure is not the end of anything, right? So it's all about guidance and your hard work, especially hard work, right? So and putting the MCQs in the right way. It's not all about knowledge. Knowledge, of course, yes, but along with that, how do you place it and guidance, right? So that's it, Adamya. So I think you are in for a. It's always good to see your students excel. It's better than you in especially. So you get to see all this genetics all into your what you call from directly from the books to your practice, because that's how the hematologists have evolved these days. Because I'm practicing daily, so before I thought this genetics, all those things, it's all in the books, but it's all very interesting to see all these things have come to your table, whatever you're practicing room. Okay. So all the best, Adamya. So we stop here. So all the best for your future. Okay. Thank you.
thank you,
Thanks,
sir.
Adamya. Thank you.